Hi everyone, welcome to Aspirant Desk. This is Dr. Vijay Anand. Now we are going to discuss the another most important topic for NEET PG general surgery. So actually they are asking around 30 to 35 questions of general surgery out of 200 questions. Okay, so it is very important to score at least 30 questions correct out of 35 in general surgery to to stay in the race and to get our dream seat. So our aspirant desk team aim is to make you very thorough in the previous year topics and previous year repeat questions. Okay, so stay tuned in our YouTube channel to get more updates and previous revision questions. Okay, now we'll move into the topic, which is we'll discuss with the question. This is 40 years old female presented with the asymptomatic varicose veins. Okay, asymptomatic varicose veins as shown below. Okay, they already mentioned it. Okay, this is an asymptomatic varicose veins. Sometimes they could ask, just see the below picture and comment about the shape classification or what is the shape classification for the picture given. So they could ask like that. Okay, but in that question, luckily they already given the answer. This is an asymptomatic varicose vein. Okay, what is the SEEP classification for the below picture? Okay, so the answer is C2A. Okay, so we'll move into that classification, SEEP classification. C stands for clinical, E for etiological, A for anatomical, and P for pathophysiological. So other subclassification is RA, R, A, and S. R is for recurrent. For example, if there is a venous ulcer, we should give the R subscript to mention it as recurrent ulcers. And A is mainly for asymptomatic and S is for symptomatic. About clinical classification, C is for clinical classification. So C0, no signs of venous disease. C1 means telangiectasia, less than 1 millimeter, or reticular veins, 1 to 2.9 millimeter. And C2 is varicose veins, more than or equal to 3 mm dilated tortuous veins is C2, varicose veins. Okay, the answer is C2. And next is C3, edema. So C4A, C4B, and C4C. C4A is pigmentation or eczema. So C4B is lipodermatosclerosis or atrophy blanchi. And C4C is corona phlebitica. And C5 is healed venous ulcer. And C6 is active venous ulcer. So this is a classification. So mnemonic is in television. So we are starting from number one. Okay, C1, C2. In television, TV, England is playing fourth Premier League competition. The batsman got injured, then healed, and then became active. Okay, so TV. So TV is telangiectasia, varicose veins. England is edema, not eczema. It is edema is playing fourth PLC Premier League competition. So C4 A B C. A is pigmentation or eczema. B is lipodermatosclerosis or atrophy blanchi. C is corona phlebitica. So fourth Premier League competition. Fourth for C4 A B C. So PLC Premier League competition. P for pigmentation, L for lipodermatosclerosis, C for corona phlebitica. So batsman got injured and then he healed and then he became active. So healed ulcer is C5, active ulcer is C6. Don't forget. First he got injured, then healed, then only he became active. Okay, don't confuse this. So first healed ulcer, then only active ulcer. So now we will see the next thing. So this SEEP classification is asked previously in 2019, 2021, 23 NEET PG exams. Okay. So signs of severe chronic venous disease is C4B. Okay. Lipodermatosclerosis and or atrophy blanchi. So C4B is signs of severe chronic venous disease. And C4C is early sign of advanced venous disease. Corona plebiscitica or malleolar flare is early sign of advanced venous disease. Okay. C4b is signs of severe chronic venous disease. C4c is early sign of advanced venous disease. And what about telangiectasia? That is less than or 1 mm dilated small tortuous veins, thread vein, otherwise called a thread vein, spider vein, or hyphen webs. And it is a time for showing you the images. Okay, for other things or for etiological classification, E for etiological, so congenital, EC is congenital, EP is primary, ES is secondary, like post thrombotic varicose veins. EN is no venous cause identified. Okay, this is for etiological. And next thing is about anatomical classification. CEA, for anatomical classification, superficial veins or perforator veins or deep veins. Okay, AN, as usual, no venous location identified. Previously, no venous cause identified in etiology. Here, no venous location identified. This is anatomical. And fourth one is pathophysiological. So, because of reflex or because of obstruction, or because of both reflex and obstruction. So, PNS, no venous pathophysiology identifiable. So, this is a picture which is showing the telangiectasia and C2 is varicose veins. TV, telangiectasia. V for varicose veins. And 3 is edema. Okay. England. So edema. This is C4A. So fourth IPLC. Fourth Premier League competition. Okay. So 4A is pigmentation. Pigmentation and mild eczema. Okay. C4A. Next one is also severe eczema, C4A. So pigmentation or eczema is C4A. And C4B is L, Premier League L. Okay. So lipodermatosclerosis or atrophy blanche. Atrophy blanche means atrophied white skin. Okay. This is atrophy blanche. This is lipodermatosclerosis with the hemosiderosis because of extravasated venous blood. And lipodermatosclerosis, there is an appearance which is called the inverted champagne bottle appearance. Okay, which is shown here. Inverted champagne bottle appearance is seen in lipodermatosclerosis. They could ask this also as a question. Okay, and C4C, Premier League competition. So C4C is corona plebiscitica, which is actually a malleolar flare. So dilated small telangiectatic veins over the ankle. Okay. So this is here present in the ankle C4C. This is C6, actually active ulcer. Okay. So I think we covered the CEAP classification. Usually they are asking some thing like asymptomatic varicose vein or eczema or edema, something. Okay, so we should be very much thorough about this classification. Okay, don't forget this mnemonic. TB, in TV, television, England is playing fourth Premier League competition. So in that, batsman got injured, healed, and then became active. So TV, telangiectasia 1, V, varicose vein 2, England, edema 3, not eczema, edema 3. Okay, third edema. Okay, PLC, pigmentation or eczema. Eczema is not edema. Okay, eczema is something related to pigmentation. So pigmentation, eczema is P. L for lipodermatosclerosis and C for corona plebiscitica. This comes under 4 C4 A B C. Okay, and healed ulcer is C5, active ulcer is C6. Okay, so this is asked previously in 2019, 21, 23, and so don't forget this C classification. I hope this classification could be asked in upcoming NEET PG 2024. And Safina varix is a actually a dilatation of veins which is present in the groin, which will be more prominent while standing position. Okay. Stay tuned our YouTube channel for upcoming question discussions and most expected make surgery simple short revision classes which we are organizing soon, and download our Aspirant Desk app. The link to download is added in description. So, dear exam, please be nice to our aspirants and all the very best for the aspirants who is preparing for upcoming NEET PG 2024. which is to be conducted in July. Keep moving forward, read well, and revise well. All the best. Thank you.